Today we'll be doing an evaluation of the elbow. You're going to want to start off your evaluations by asking a couple of history questions, such as whether it's an acute or a chronic injury, how the injury may have occurred, if there's been any changes in their daily exercise routine or anything else that could have caused this pain. You would ask them to describe the type of pain, and you would ask them to place it on a pain scale from 1 to 10. Next, you're going to move into your observations. You're going to want to look at the patient's elbow, seeing if there's any sort of swelling on the medial or lateral side. You're going to want to see if there's any discoloration or bruising or swelling present. And then the next thing you can do is, if you slide back, you can have them put their arms out to their side, and you want to check for the carrying angle right here. You want to see if there's any cubital varus or valgus. His arm seems good. And then if you look on the back side, you can locate the medial epicondyle, the lateral epicondyle, as well as the olecranon process, and look at the isosceles triangle to see if there's any sort of structural pathology there. The next couple of palpations that we'll do are those three structures. You can palpate the medial epicondyle here, the lateral epicondyle, and the olecranon process is very easy to find. Next, we're going to test range of motion. The motions that we'll test are flexion, extension, pronation, and supination. First we'll do this passively, seeing if they can do flexion and extension, and pronation, and supination. Next, you'll ask them to just go through those same motions: extension, pronation, and supination. Then you can also have them do it resisted. So if you put their arm in a neutral position, apply resistance distally. Flexion is good. Good. If you hold my hand, roll over. Good. Roll back. Good. Then you can also take range of motion with a goniometer. First, if you can just slide back, try to extend that arm fully. Taking the fulcrum and putting it right on that lateral epicondyle, and running the stationary arm up the shaft of the humerus with the movement arm down the shaft of the radius. You can have them flex, looking for a measurement between 145 and 155, and he's within the normal limits. You can also test it bilaterally just to compare. Next, you can take any sort of wrap or towel, place it under the elbow, and if you just have them drop their arm, you're looking to see, with the same fulcrum placement, you're looking to get a reading of about 0. Anything past 0 would be indicative of cubital recurvatum. The next thing you can do is you can have them grasp a pin in their hand like so. You can take a smaller goniometer, putting the fulcrum right on the knuckle of the third digit. You're going to have your goniometer in 180 degrees, and you can just follow the pin, whether they pronate or supinate. You're looking for a measurement of about 90 each direction, and you can go the other way. So he's a little bit short in those motions, but if you check bilaterally, you can rule out any sort of pathology there. Next thing that we're going to do are manual muscle tests. It's the same 4 movements that we're doing, just applying resistance. In flexion, you're going to be testing the biceps brachii. Extension, you'll be testing the triceps. In supination, you'll be testing the supinator muscle. And in pronation, you're testing the pronator teres. Then you can move into your special tissue assessment. The first one we're going to do is the valgus stress test. Applying a valgus force, you're checking for the stability of the UCL, the ulnar collateral ligament. On the other side, you can do a varus stress test the same way, testing the radial collateral ligament. And in a third special test, you can do resistance tennis elbow by having them go into pronation, finding their third digit, applying resistance, and having them try to lift it off the table. And relax. And in the last special test, you can have them roll over and perform Tenelstein by finding the medial epicondyle and the olecranon process and simply tapping within here, asking them if they're experiencing any numbness or tingling down the arm.